At this commencement, we're graduating 162 students in 4 separate degree programs. Each one is a healthcare-related profession. The first is the medical student education, and they receive the MD degree. The other 3 are master's degrees: marriage and family therapy, public health, and preclinical science. This is our 28th commencement, and we are proud of each and every one of these students.
As soon as I leave residency, I want to be an outpatient internist who does primary care in an underserved area, preferably rural. Both my husband and I are really drawn to those types of communities, and just hoping to establish a great, I guess, connection with the community and the patients I'm treating, and to know them not just as patients.
The program has exposed me to a greater variety of topics in the healthcare field and really broadened my interests. I would have never had an interest in family medicine prior to coming here, but after being here in the program and in Macon, and I volunteer at the Macon Volunteer Clinic and working with some of the family practice physicians there, I've really, I could see myself getting into that also.
The bonds and relationships that I've developed through this program, whether it's through friendships or networking through different public health organizations and programs, getting guidance from advisors and faculty members. So I just kind of think the conglomerate of all of that together is my big moment that let me know that Mercer was where I was definitely meant to be.
Looking back at all of our experiences here at Mercer, we have so many different personalities, so many different backgrounds, and just the one thing that's so cool about this experience is that we've all gone through it together, and we've all done it together, through the bad, through the good, and I think it's just really special that our class has achieved this great accomplishment together.
So coming into the program here at Mercer, the public health program, I had a lot of field experience. And I think through that field experience, I realized that I needed a lot of tools to address needs that I saw. Mercer has really helped me kind of harness the ideas that I've had coming into it and that energy and passion, and polished it to a good working tool of, you know, giving me a tool bag essentially to address the needs that I see in the communities.
I feel elated, and I'm so excited. The closer we get to graduation day, the more excited I feel, and it's kind of surreal. I remember being in the 5th grade talking about getting a master's degree, going on to get a doctoral degree, and as all of these things are unfolding, I'm kind of like, wait a minute, where has the time gone? I was just 11. And I'm going on 24, and I'm about to have a master's degree, and then in September I'll be starting a PhD program, so it's surreal. I kind of feel like a grown-up a little bit, but not too much.
Mercer prepared me for residency program in pediatrics in several ways. Beginning your first year at Mercer, you're given a lot of autonomy. You start seeing patients in clinics, and you get hands-on experience from the first year, which is unique to Mercer. Not very many medical schools give you that kind of experience that early on. And I think, especially working with children, that's going to be a big benefit because I've had 4 years of experience hands-on in a clinic. So I think I'll be very prepared for residency in that sense.
I'm excited. I'm really excited, and sometimes I'm thinking like, wow, I just graduated and now I'm about to have a master's. Like, it's pretty crazy, and like, I guess we're so busy like, all the time studying that we don't actually think about what we're actually accomplishing at the end of the day. And I feel like it's gonna be a lot more rewarding when we see that degree at the end.
Well, now that medical school's finally finished, I guess there's a mix of excitement and being terrified at the same time. For us, the transition from being a medical student to a doctor is a huge one. And then for my wife and I, it's aided by the fact that we're also going to New York, and so all these different life changes and everything it's very stressful, but it's exciting at the same time. We're definitely not used to being called doctor yet, and I don't think we will get used to that for quite a while. We felt like imposters when we were called medical students, and we're only going to feel more like that now, but I guess we'll fall into that role as well eventually, and we'll grow to fill those shoes and eventually outgrow them as well, and look for the next stage, but definitely very excited about moving on to residency.
That moment of seeing your client come to you during the first session and they are overwhelmed with so much hurt, and just knowing that you're able to help that individual, it gave me that sense of, okay, Lakia, you are in the right field. This is where you're meant to be, because I've always wanted to help people. And to be able to see that my work is helping someone was my moment of, I'm where I'm supposed to be.